Have been a lot of developments in the last week with the COVID-19 vaccine and kids. And right now we're joined by Dr. Jeffrey Potoff from UW Health. And really quickly, to go through this timeline for kids 5 and under for the vaccine, the White House says that we could expect those vaccines to be available by June 21st. What would be the difference between a private facility, a state facility for parents?
Yeah, for the most part, for parents, where they get their child vaccinated, if indeed the FDA approves this and then the CDC approves it, it probably won't make much difference. Really what's more convenient, what's close to home, whatever they can do to get their kid vaccinated quickly. I know a lot of parents that have those young kids are worried about those young kids. I think they'll breathe a sigh of relief when they get that first shot done.
And again, we're waiting on approval, and that date that's slated is June 21st. Of course, things can change. Doctor, have you been seeing any type of hesitation to get kids vaccinated still at this point in the pandemic?
We do see some, and I think, what I commonly hear is most people know that children are less likely as a population to have severe disease meaning death or hospitalization. And I think parents then think, well, it's not a big deal. It's kind of inconvenient. They might have those symptoms that I had after my second shot, where they might pop a fever and be irritable for a day. So they start to think that maybe the benefit's not there. Unfortunately, although kids get sick at a lower rate than adults do as far as severe disease, they do sometimes get really sick, and some children have died of COVID. But it's not just whether they live or die. It's really, are they going to develop long haul symptoms? Are they going to be out of sports for the summer? There's so many other reasons why it's beneficial to get your child vaccinated, whether than more so than just whether they go to the hospital or not if they got COVID.
And when it comes to being considered fully vaccinated, does that include boosters nowadays?
Yeah, that's kind of a tricky thing. I think for most of us, we should consider fully vaccinated your original series, which for most of us is 2 shots. For these kids that are likely to be eligible to be 3 shots, plus any additional boosters that are authorized down the road. Certainly, your protection against severe disease is better than nothing after the original 2-dose series. But if you really want to avoid getting sick or having more severe symptoms, keeping up with those boosters is really important.
And I wanted to get your thought on this, too, because Dr. Anthony Fauci was talking about the need for a different kind of vaccine, whether it be an oral or nasal intake. What's the latest that you know on that?
Yeah, I think this would be a nice to have. As we can all imagine, having to get injections isn't very much fun. Logistically, it's a lot more difficult as far as transporting those vials around, having the syringes and the needles to administer it. People specifically trained on how to administer that. It would be so much easier to vaccinate people quickly and in large quantities if we could, do a nasal spray. That would be easy, a pill that we could take. Those types of advancements would make vaccination a whole lot easier, both for COVID, but for other diseases too.
All right, so more to come on that. Dr. Jeffrey Potoff, thank you so much for joining us.